childbirth, a moment of joy and anticipation, the culmination of months of nurturing a life within. But what happens when this beautiful process takes a dangerous turn? What happens when the very space that nurtured and protected a baby threatens the life of the mother? This is the stark reality of uterine rupture, a rare but serious complication that can occur during labor. This essay will delve into the intricacies of uterine rupture, a topic often shrouded in fear and misinformation. We will explore its causes, risk factors, and most importantly, the life-saving measures that can be taken to ensure the well-being of both mother and child. While childbirth is usually safe, it's crucial to be aware of potential complications. Uterine rupture is one such complication that requires our attention and understanding. By shedding light on this critical issue, this essay aims to empower expectant mothers with knowledge, enabling them to make informed decisions and advocate for their health and safety during this extraordinary journey of childbirth. Uterine rupture is a rare occurrence, but its potential for severe complications makes it a serious concern for expectant mothers. This is not about instilling fear, but about promoting awareness. Imagine the uterus as a balloon that expands throughout pregnancy to accommodate the growing baby. A rupture is essentially a tear in the wall of this balloon, a breach in the safe haven that houses the baby. This can lead to life-threatening complications for both mother and child, including internal bleeding, fetal distress, and even death. The rarity of uterine rupture should not be mistaken for insignificance. It's like a rare allergy. Even though it doesn't affect everyone, it's crucial to know about it, especially if you're at risk. Understanding this condition is not about dwelling on the negative, but about equipping ourselves with the knowledge to recognize warning signs and seek timely medical intervention. This proactive approach can mean the difference between a healthy birth and a tragic outcome. Misinformation often breeds fear, and uterine rupture is no exception. Let's debunk some common myths surrounding this condition. Uterine rupture only happens during vaginal birth after a cesarean section, VBAC. While VBAC does increase the risk, uterine rupture can occur in women with no prior cesarean scars, especially if labor is induced or augmented with medications. Uterine rupture is always obvious and easy to detect. Symptoms can be subtle and easily confused with other pregnancy discomforts. This underscores the importance of open communication with your healthcare provider throughout pregnancy and labor. If I have a uterine rupture, my baby will definitely die. While uterine rupture poses serious risks to the baby, prompt medical intervention can often save the baby's life. By dispelling these myths, we can approach this topic with clarity and focus on evidence-based information. Remember, accurate knowledge is power, especially when it comes to our health. Knowledge is indeed power, and in the case of uterine rupture, it can be life-saving. Understanding this condition involves grasping several key aspects. Uterine rupture is a tear in the wall of the uterus, the muscular organ that houses the baby during pregnancy. This tear can cause severe internal bleeding in the mother and deprive the baby of oxygen and nutrients, potentially leading to life-threatening complications for both. While any pregnant woman can experience uterine rupture, certain factors increase the risk, such as a previous C-section, multiple pregnancies, or being over 35 years of age. While not all cases are preventable, understanding the risk factors and discussing them with your doctor can help minimize the chances of uterine rupture. This section has provided a basic understanding of uterine rupture. In the following sections, we will delve deeper into each aspect of this condition, equipping you with the knowledge to make informed decisions about your pregnancy and childbirth. Section 5. Uterine rupture when the cradle cracks. Imagine the uterus as a strong elastic sac that stretches and grows throughout pregnancy to accommodate the developing baby. Uterine rupture occurs when this sac, weakened for various reasons, tears under the pressure of labor contractions. This tear can be complete, where all layers of the uterine wall are breached, or incomplete, involving only the inner layers. Complete ruptures are more dangerous as they allow amniotic fluid and even the baby to spill into the abdominal cavity. The location of the tear also varies. It can occur at the site of a previous C-section scar, along the lower segment of the uterus, or in rare cases in the upper part of the uterus. Understanding the different types and locations of uterine ruptures helps healthcare providers determine the best course of treatment. Prompt diagnosis and swift medical intervention are crucial in managing this obstetric emergency. Section 6. Risk factors, identifying potential dangers. Certain factors can increase a woman's risk of uterine rupture. Awareness of these risks is crucial for early detection and management. The most significant risk factor is a previous C-section. Scar tissue from a C-section is less elastic and more prone to tearing. Multiple pregnancies stretch the uterus, increasing rupture risk. Labor induction can cause strong contractions, raising rupture risk. Women over 35 are at a slightly higher risk. Other factors include placental abnormalities and uterine trauma. Having risk factors doesn't guarantee a rupture but requires vigilance. Section 7. Prevention is key, reducing the risk of uterine rupture. Certain measures can significantly reduce the risk of uterine rupture and ensure a safer childbirth experience. Discuss VBAC with your doctor to assess individual risks. Close monitoring of labor is essential to manage contractions. Open communication and early detection are key. Proactive steps can reduce your risk and ensure a safe delivery. Section 8. Timely intervention, life-saving treatments for uterine rupture. Uterine rupture is a serious medical emergency. Timely diagnosis and swift intervention are crucial. An emergency C-section is often performed to deliver the baby quickly. This allows doctors to control the bleeding. Surgeons will repair the tear in the uterus. Sometimes a hysterectomy is necessary to control bleeding. Blood transfusions may be required to restore blood volume. Close monitoring of vital signs is crucial. Pain management and emotional support are essential. With prompt attention, most women and babies recover well. Section 9. Real stories, real courage, triumph over tragedy. Behind the medical terms and statistics are real stories of women who have faced the terrifying reality of uterine rupture. These stories highlight the importance of awareness, early intervention, and the resilience of the human spirit. Sarah, a mother of 2, experienced a uterine rupture during the labor of her second child. Thanks to the quick thinking of her medical team, both she and her baby survived. Sarah now advocates for greater awareness of this condition, sharing her story to empower other women. Another mother, Maria, wasn't as fortunate. Her uterine rupture, though rare, went undetected until it was too late, resulting in the tragic loss of her baby. Maria's story underscores the importance of listening to your body and seeking immediate medical attention for any unusual symptoms during pregnancy or labor. These stories, while heartbreaking, remind us that knowledge is power. By understanding the risks, recognizing the warning signs, and advocating for our health, we can strive for safer pregnancies and healthier outcomes for both mothers and babies. Section 10. Knowledge empowers protecting yourself and others. We've journeyed through the complexities of uterine rupture, from its causes and risk factors to life-saving treatments and the emotional toll it can take. The takeaway is clear: knowledge is power. Armed with information, you can engage in open and honest conversations with your healthcare providers, advocate for your health, and make informed decisions about your pregnancy and childbirth. Share this knowledge with friends, family, and your community. By spreading awareness, we can collectively work towards reducing the incidence of uterine rupture and ensuring safer deliveries for all mothers. Remember, childbirth is a beautiful and transformative experience. Let's approach it with knowledge, courage, and a commitment to protecting the well-being of both mothers and babies.